On the third anniversary of the Supreme Court's Dobbs decision overturning Roe v. Wade, Lieutenant Governor Sara Rodriguez takes a clear-eyed look at how reproductive health care has changed, nationally and right here in Wisconsin. From the Trump administration's playbook for a nationwide abortion ban to Wisconsin Republicans' attempts to get in line, this episode breaks down the consequences for women, families, and communities across the state. Plus, what Governor Evers and Lieutenant Governor Rodriguez are doing to fight back, and how you can help protect reproductive freedom in Wisconsin.
Hi, everyone, and welcome back to the Rodriguez Report, the show about building a stronger, healthier, and more resilient Wisconsin. I'm your Lieutenant Governor, Sara Rodriguez, your host, a nurse, a mom, and someone who believes that no one, no politician, no judge should get to make personal healthcare decisions for someone else. Tomorrow marks 3 years since the Supreme Court, with 3 Trump-appointed justices, struck down Roe v. Wade, removing nearly 50 years of federal protections for abortion. That decision didn't end the fight over reproductive rights. It supercharged it. Let's talk about what's happened since, how it's touching every corner of Wisconsin, and what we can do about it together. Since that Dobbs ruling, Donald Trump and his allies have pursued a full court press to ban abortion nationwide, using every branch of government, executive orders, legislation, and the courts to dismantle reproductive health care in every state, including Wisconsin. The playbook? Cutting Medicaid funding, defunding Planned Parenthood, targeting safe medications like mifepristone, and stacking courts and presidential cabinets with anti-abortion extremists. This spring, the administration froze nearly $66 million in Title X family planning funds, jeopardizing contraception, cancer screenings, and STD testing for low-income patients. Title X's entire $286 million program is now under threat. Even after the Supreme Court unanimously preserved access to mifepristone last June 13th, a pill used in almost 2/3 of U.S. abortions, lawsuits keep coming, aiming to roll that victory back. Roughly 1/3 of sitting federal judges owe their robes to Trump, many chosen for their hostility to abortion rights. Bottom line, the goal was never just to overturn Roe. It's to erase abortion access everywhere. It's coordinated, strategic effort, and it's happening in plain sight. Here in Wisconsin, the Dobbs decision immediately halted abortion services across our state, not because voters demanded it, but because of a law from 1849, a law written before women had the right to vote, a law that made performing an abortion a felony. Providers here in Wisconsin paused services, unsure if they'd be charged with felonies under that 1849 criminal statute. A state judge has since ruled that law targets assault, not voluntary abortion, so some clinics have cautiously reopened, but only in our largest cities. Wisconsin is home to 1.3 million women of reproductive age. If you live in Rhinelander or Richland Center, nearest clinic may now mean Minnesota or Illinois. But instead of modernizing our laws, Republican leaders doubled down, despite the fact that a majority of Wisconsin residents consistently support abortion remaining legal in all or most cases. During debate, Republican legislators and leadership dismissed discussion about rape and incest exceptions as, quote, unnecessary, and argued abortion, quote, is not health care, comparing human pregnancy to veterinary care. These aren't fringe quotes. They're the mainstream position guiding our state legislature. Meanwhile, Assembly Republicans tried to impose a restrictive 14-week limit through a referendum. This is what we're up against. Out-of-touch rhetoric and outdated laws that have very real, very dangerous consequences for people in our state. So what is the real-world impact? As a nurse, I have witnessed the devastating effects for women and families who do not have access to a full range of reproductive care, including prenatal, contraception, infertility, and abortion care. Wisconsin has limited abortion facilities, all in urban areas, leaving rural communities without local options. Women must travel long distances, sometimes out of state, just to access reproductive care, wait weeks for care, or forego treatment entirely, leading to significant health risks and economic hardship. When care is delayed or denied, the results are devastating. Pregnancies become more dangerous, families face higher medical bills, people lose wages, jobs, and in some cases, the chance to start or not start a family on their own. This isn't just about one procedure. This is about economic freedom. It's about bodily autonomy, and it's about who gets to decide. Governor Tony Evers and I refuse to stand by. We're pushing hard to ensure every Wisconsinite has access to essential care. In our recent budget, we proposed expanding Badger Care to cover nearly 90,000 more people, bringing billions of federal dollars back to our state. We proposed extending postpartum Medicaid coverage from 60 days to a full year, critical support for mothers. And we invested in rural clinics, doula services, and contraception access. As your Lieutenant Governor, I've also been proud to chair the Healthcare Workforce Task Force, bringing together doctors, midwives, legal experts, and community voices. I've supported our administration's lawsuit to challenge the 1849 criminal ban, traveled to all 72 counties to listen to residents, patients, and providers firsthand, because policy shouldn't be made in a vacuum. And before I served statewide, I was a state legislator, and I co-authored legislation to repeal Wisconsin's 1849 abortion ban. Of course, the Republican majority wouldn't even give it a hearing. But that didn't stop me then, and it won't now. Because every person deserves the right to make their own reproductive health care decisions without interference from elected officials who know nothing about their faith, their family, or their circumstances. Thank you for tuning in. Today's episode informed you or fired you up. Share it with a friend, leave a review, and keep the conversation going. We need your voice now more than ever. We can't do this alone. Here's what you can do today. Call your legislators. Tell them to repeal the 1849 ban and expand Medicaid. Support local clinics. Whether it's donating, volunteering, or escorting patients, every action matters. Share your story. Personal experiences are powerful and persuasive. Vote every single election, because from school board to president, every level of government plays a role in this fight. Together, we'll build a Wisconsin where healthcare decisions stay where they belong, between a patient and their provider. I'm Lieutenant Governor Sara Rodriguez. See you next time on the Rodriguez Report.